Now, doctors are threatening to keep on striking until the summer. This is after members of the British Medical Association, the BMA, voted in favour of further walkouts. Let's have a listen to Health Secretary Wes Streeting speaking. This is just before Christmas on the issue of industrial action.
We did everything we could to avert these strikes, even meeting for hours with BMA officials yesterday to see if even at the 11th hour we could avert the strikes. After constructive discussions, we still weren't able to persuade the BMA either to come into negotiations or indeed to delay strikes to January as I had offered. Our entire focus now is on keeping patients safe, particularly over the next 5 days of strike action, but also through what is the peak period for the NHS.
Yeah, well, he's got his views and the BMA have theirs. Let's speak with Dr. Dean Eggitt, GP, CEO of Doncaster Local Medical Committee. Always good to see you, Dean. I mean, this is clearly troubling, and I'm bound to say, and I think you might concur, troubling for patients.
Yes, Ian, good to see you again. I'm sorry we're here again. This is strike round number 14. And yes, it is troubling for patients. And honestly, I think I want to start off by saying that although there was a reasonable turnout, there's 52% of resident doctors who were eligible to vote, who did vote, and they got 90-odd%, I think, in their ballot. So really strong mandate there. That still only represents about a third of resident doctors. So please, patients, don't see this as a sign of the NHS wanting to leave you high and dry. This is a minority of doctors, really, yeah, who want a pay rise and are willing to take strike action for it. So I'm sorry, patients, you're going to be in trouble yet again, and held to ransom by about a third of resident doctors. Yeah,
it is, of course, it's an incredible, breathtakingly expensive process for the NHS when this happens. And, of course, you know, I know there is always this, you know, the BMA always put out a line that no patient will be in danger and, you know, that there are agency staff can come in to cover the shifts, etc. I mean, I think, Dean, that stretches it a bit. I'm pretty sure if you remove a significant amount of clinicians from their shifts, then you, at the very least, run the risk of there being a knock-on effect to the detriment of patient care.
Yes, well, we just have to be quite clear about this. This harms patients, and I'm really not fussed about what the BMA say about this doesn't harm patients. What they're saying when they say that it doesn't harm patients, they mean that suddenly there isn't a spike in patient deaths in hospital when these strikes occur. Now, the reason why there isn't a spike in patient deaths is because senior doctors step in and hospital trust buy in extra staff to take care of patients during that time. And importantly, they also reduce the number of people that are having operations or routine procedures at that time to protect patients. So yes, there isn't a spike in deaths in hospital, but what there is a spike in is people sat at home languishing in pain, struggling to get the treatment that they want because it's been delayed because doctors aren't in work. So this is not harmless, this is harmful. It's harmful with patients at home that aren't seen and aren't counted.
Indeed, and that knock-on effect, as you rightly say, is not always it's not always glaring and staring at you. We're not just because nobody dies doesn't mean there's not. It's not the only criteria for a problem, of course. 26% pay rise. This is significant. The argument that comes from the BMA, they have a slightly different way of counting inflation, but nonetheless, the broad brush of their argument is it's not a pay rise, really. This just takes us to where we should be had we been given incremental pay rises over the last X amount of years. That's more or less, I think, their argument.
And you know what? I'm inclined to agree. The pay offer that's going to be put to resident doctors this year is going to be 2.5%. And when you look at all of the rises in cost that are around us, that's not going to cover costs. Now, if you say that that's been going on for a decade, which indeed it has, you can see that pay rises across the world will eat into your cash and therefore effectively look like pay cuts. And that's what resident doctors are trying to say. But that applies to everybody. That applies to me, that applies to you, Ian, that applies to all of the people who are watching at home. We all have to tighten our purses because the world is just a more expensive place. And doctors are not unique in that. So to have already had a nigh on 30% pay rise and 1 to 26% extra is incredibly hard to justify. Doctors should get paid a lot of cash. It's a hard job. It's a lot of hours. It's a lot of work. So you would expect them to get paid a lot. But you can't do that in isolation. If doctors get paid more, then nurses will get paid more. Everyone will get paid more. And quite frankly, that is unaffordable. What doctors are asking for is to be treated uniquely, and that's just not okay.
Dean, on that point, thank you very much indeed. That's Dr. Dean Eggitt, regularly helps us out on these kind of stories. It's not okay. I think most of us concur with that. Unless you're of the opposite view, you go, no, I support these doctors on this. I understand you could play this game all day long in all manner of professions, private sector, public sector, about what is fair, what is not fair. I've never, ever, maybe this is just me, maybe it's the whole part of the whole thing of being self-employed all of my working career, that I never expect there to be an inflationary linked pay rise on an annual basis. I've never expected that. Once in a while you have a contract negotiation. You sit down and you suggest a pay rise, and sometimes you might get it. It might be small, but maybe symbolic. Sometimes you think, well, I've got what I wanted. Other times, there's nothing at all. Literally, sorry, mate, there's no pay rises. We're not giving any pay rises. It's just the way it is. And I've never questioned that can be, it's not a one-way street of increase is the way I've always looked at that. 034